An alternative method of performing hip replacements is now making inroads here in the U.S. Proponents of this new method say it's both less invasive and can significantly cut down on the amount of recovery time. For Hank Minke, skateboarding with his kids is like having his life back again. The 47-year-old father of two spent decades pursuing extreme sports, including professional surfing.
Surfing, skateboarding, martial arts, jiu-jitsu.
But eventually, Hank wound up shredding much more than the waves. After suffering increasing pain in his lower body, an MRI scan finally revealed severe hip damage.
They said I had no cartilage left at all and that the joints were well past worn out, and that in my case I needed to have both of my hips replaced.
Modern hip replacements are made up of a few different parts.
He turned to surgeon Nicholas Mast at St. Francis Hospital in San Francisco, who specializes in an alternative procedure known as anterior hip replacement. Its proponents say it's less invasive and allows the surgeon to minimize the amount of muscle tissue cut during the operation.
But probably the most important one for the patient is that there's reduced recovery time and less postoperative restrictions.
We watched as Dr. Mast performed an anterior replacement. It involves the use of a special table that immobilizes the leg and allows the surgeon to enter from the front of the thigh as opposed to the rear or posterior approach. The system relies on X-ray imaging to help guide the placement of a rod into the femur, capped with a new artificial ball joint.
Picture?
Like other proponents, Dr. Mast believes this less invasive approach leaves the joint more stable during recovery and lessens the risk of separation. But critics say there is no conclusive evidence of the pros and cons of the anterior approach versus traditional hip replacement. Interest in it is growing so much, though, that the Mayo Clinic has just launched clinical trials comparing the two. Data from that, though, won't be available for several years. After implanting the ball and joint, Dr. Mast compares the placement to images taken before the procedure.
So we've got a pretty good reproduction of his normal geometry of the hip.
Supporters say the technique can shave several weeks off of recovery time. Hank was back home 2 days after his double hip replacement, and he's now 7 months into his recovery.
You know, I pretty much have my life back, which is really amazing. I surf and skateboard. I'm back to almost back to training jiu-jitsu lightly, and the most important part is I'm able to be with my kids.
Now, Dr. Mast says the technique can be used with a variety of artificial hip devices and does not limit you to a specific brand of implant.